Hello, namaste. My name is Janice. For those of you who've been here before, welcome back. And for those of you who are joining me for the first time, my name is Janice and I'm a yoga therapist and a fitness instructor. And I'd like to share a little home practice for you with some gentle movements for back care. And I'm going to show you a couple things that you might want for your practice today. A yoga block. This is a 2-inch yoga block. If you don't have a yoga block, not a worry. You could use a towel folded up to be about 2 inches. Could even be more. You could also use a blanket. And then also this is a 3-inch yoga block. So it's a little bit fatter. So I'll explain how we're going to use these. And these are just some ways that you can use things around your house. So it could be a towel, could be a blanket, could be a block if you have one. And a yoga strap, which could also be a house coat or a belt, something that you can use that will provide a little support for you in our hamstring stretch today. The other thing that some people like to use that I'd like to introduce would be a dowel. Really easy to make, and just a piece of fancy word for a stick, and you might want to use that as well. I'll show you how you can use this in your practice. And so those are a couple of the tools we'll use today. If you do have other yoga props like bolsters or an eye pillow for Shavasana at the end, you could bring that in. And that's about all we're going to use today. And so we'll start lying on the ground, and we're going to start in constructive rest. There's 2 versions of constructive rest. You can explore that a little bit here. So as I come down to the ground, good. This is constructive rest with the legs more parallel. The second option might be dropping the knees into each other and widening the feet a little bit so you have a nice support here. This is a really undervalued position. It really helps the body settle, encourages the nervous system to start to soften and relax a little bit. And a good time to just ground the body and check in. So you might close your eyes here and take 3 big breaths in the nose, slowly out the mouth. Yeah, just encouraging your body to sink into the floor and the support beneath you. Maybe one more. And then just taking a moment, whether your eyes are open or closed, is whatever is most comfortable for you. I find if I close my eyes, it can allow the face muscles to relax a little bit more, encouraging your jaw to soften and all the muscles in your face. As you just take a moment to check in with how you're feeling right now in this moment in your physical body. Just encouraging the body to start relaxing down into the floor beneath you. And just starting to notice your breath coming in and out without necessarily having to control it, but just notice. Breath coming in and out. Well, there are hundreds of breathing exercises, and I'd like to share some special pranayama practices with you in another video. For today, my suggestion is to just breathe in a way that's comfortable for you. Ideally, in the nose, out the nose is really helpful for most of the practice if it's available to you. In the nose, out the mouth, sometimes to release tension, sometimes called a cleansing breath. You might do those sigh breaths from time to time. But if you can, and if it's available to you, just notice. If you can just sense the breath coming in the nose and out the nose. Noticing maybe where the body moves as you breathe. And then setting your intention for your practice today. Perhaps that's to move with kindness, gentleness, curiosity, to back off, to do less. When you're ready, we're going to go into our first movement. So I'm going to bring my feet more parallel. So this is that second form of constructive rest. And from here, we're going to work mainly with some little
bit of belly breathing to your best ability. I'm going to place the hands on the lower belly, and as I breathe in the nose, I'm going to encourage my belly to expand out. And on the exhale, I'm just going to encourage my belly to sink back towards the mat. Let's try a few, just focusing on encouraging your breath to expand your belly out as you breathe in. And on the exhale, the belly softly sinking back. Good. And we're going to add on to that with some gentle pelvic movement. So we're moving the pelvis, tilting it into its gentle range of motion. And I encourage you to start really small. Really important way to get the pelvis moving, a little bit of flexibility and hydration into the fascia around the lower back. So as I breathe in the nose and I let my belly fill, I'm going to encourage my back to arch a bit. So there's a little bit of space between my back and the mat. And on the exhale, letting my back body flatten onto the mat. On the inhale, belly fills, spine gently arches. On the exhale, back body sort of lengthens towards the mat. If you find any sensitivity here, explore small ranges of motion. So the pelvis is tilting a little bit to the ceiling. And now the back body is lengthening down towards the mat. Just try that 2 more times. Good. And taking a moment with a little sigh breath, notice where your body settles. Good. I'm going to do our first movement to stretch the psoas muscle, which is my sort of favorite muscle to work with. It's the muscle that connects your leg to your spine. It's the only one. It's really important for back care. Your options might be the 3-inch block, the 2-inch block, or your blanket. So I folded this blanket into about a 2-inch height, and that could work great for most bodies. I'm going to choose my 2-inch block, which is about the same as the blanket, but since I have a block, it's a little handier. I'm going to use the block. Okay? So you could use something higher if you only have a 3-inch block. That will work too. So it's like a supported bridge. So I'm going to press into my feet a little so I can lift the hips off the floor for a moment, sliding the block underneath the pelvis. So I'm really letting my pelvis sink into the block. If the block is too high, the tailbone will fall off the block, not very comfortable, and it creates a pelvic tilt. And so if it's too low, you'll feel like you're sliding off of it. So somewhere in between, where you feel like the whole back plate of the pelvis can really sink into the block or your blanket or your cushion or your towel or whatever you're using today. Then I'm going to slide my right leg along the ground. And I'm going to see about my left arm going overhead. I really like the idea of leading with my elbow, sort of bringing the elbow towards the face and overhead. If your arm doesn't go there, it's okay. I'm going to turn the head a little bit to the right, and I'm going to take 6 breaths here. And 3 more breaths here, just really sinking into the space, softening the jaw. Good, and feel free to stay in any of the positions longer or come out before my cues or add on, leave something out. Make this your own practice. So then I'm going to bring the arm back down to my side. As I bend that leg, I'm going to do the other leg. So I'm going to slide the leg out. So I like to kind of gently turn the foot inward slightly if I can. And maybe leading with the elbow, floating the arm over the head, resting on the floor, turning the head. Taking a sigh breath to settle in. And then just taking a moment here to relax. Take 3 more breaths. Noticing if your mind wanders off from this moment, just take a moment to notice and then come back to something that's physically present for you in the moment here. Good. And taking a moment in your time to bring feet to come back and the arm comes back. So we'll revisit this position with some support underneath you in a few moments, but we could try to do a full stretch here where you stretch out one leg and then you stretch out the other leg, and then the arms can stretch overhead if you choose to. It's such a nice way to sort of counter all of the forward flexion we do sitting and biking, walking. So really helping the front body start to open a little bit here. And you can stay here as long as you'd like. I'm going to stay here for 3 more deep, slow breaths in the nose, out the nose. Softening the jaw. Find your breath. Taking a moment in your time. I'm going to bring the arms back to your side. Bend the knees. I'm going to press into the feet to lift the hips so I can take out the block. Slowly lowering down. Okay. I'm going to bring my knees into the chest, just rocking side to side. Another option here could be using your dowel, which is a super great way. Hold it behind your knees, and then you can do some circles. You don't need to use a dowel. You could just hold your knees. I really like the dowel. Sometimes it's a nice option. Circles. Good. Doing the both directions. You might even try the little smiley face movement, a little over and up, and then a little over and up. And taking a moment in your time for the feet to come back to the mat. We'll take the dowel and place it on the side for now. All right. So let's do some windshield wiper movements just to warm up the hip joint a little bit. And then I'm going to invite you to try 2 movements to help find stability in the pelvis. If at any time, any position feels uncomfortable, creates extra pain in the body, or you just know your body just doesn't want to do that, you can just skip over it, modify it, move on, take a moment to take a break. So those are all options. So I got my feet a little wider, maybe the width of my mat, and I'm just going to allow the knees to float a little bit like windshield wipers. Inhaling up, exhaling over. I'm going to try that 3 more times. One more time either side. Good. Okay. All right, so we're going to go into a pelvic alignment series of movements. So I'm going to drop the knees into each other. And this is a very gentle isometric exercise. Isometrics are sort of when we create a little force in our own body, but not much happens on the outside. So it's more an engagement that you might just gently feel on the inside. So with my knees touching, I'm going to take a breath. On the exhale, I'm going to push my knees into each other as if I'm squeezing something between my knees. I feel my back flatten, I feel my core muscles engaging, and then I relax. So I'm going to try it 2 more times. Take a breath. Exhale, squeeze the knees into each other, and then relax. Take 1 more. Squeezing the knees into each other, and then relax. Good. Wonderful. All right, so the second part of that alignment series is to walk the feet together. Drop the knees out to the sides. Sometimes, for some bodies, it's nice to take palms down to the sides of the hips. And then as you drop the knees out to the sides and the soles of the feet to come together, you have a little cushion. It's optional. You could also use some yoga blocks. You could kind of wedge your yoga blocks in towards your hips there if you need more support. If this is causing you more pain, than it's worth, then of course you don't have to do it. With everything, please feel free to omit and modify. All right, so here I am. I can feel the outer edges of my feet touching the mat. I'm going to take a breath. On the exhale, I'm going to push down into my feet. And for me, my hips lift up off the floor. For some people, they don't actually lift off the floor. That's okay. And then relax down. So take a breath. Exhale, pushing down into the edges of my feet. The hips lift a little bit up off the floor. And then down. You might try that one last time. Good. And then back down. And I'm going to take the legs back together. Little knees to chest for a moment once again. Could be with the dowel, could be without. Little movement side to side. Good. All right, and then when you're ready, I thought I'd share with you one more little isometric exercise you can do. It's a really nice way to help keep those SI joints. Those are the two weight-bearing joints at the back of the pelvis. They're like two little knobby bits. And so I'm going to take a breath in. On the exhale, I'm going to bring one leg in, lace my hands together. Your hands could be on your shin. The hands could also be behind the thigh. Whatever's most comfortable for your body today. Okay, this is my preference. So an isometric exercise. On the inhale, I'm going to push my leg out into my hands. On the exhale, I'm going to relax. And that's pretty much it. This is a great one to do in bed in the morning, especially if you have SI joints that slip around or cause you any grief in your day. So I'm going to take a breath, pushing out. Exhale, relax. Yeah, I'm going to do it one more time. Inhale, pushing out. And exhale, relax. Good. Wonderful. I'm going to do the other side. Take a big breath. Arms stretch overhead. Exhale, bringing your other leg in. Hands lacing, securing your leg wherever it's comfortable. Inhale, pushing the leg out into the hands. Exhale, relax. Inhale, pushing out. Exhale, relax. Yeah, one more if you can. Good. Wonderful. And then bringing your leg back down to the floor. All right. So I thought we could do a little hamstring stretch today. And there are a lot of ways to stretch your hamstrings. So you could use a strap. You could also alternatively just use your hands behind your thigh. Okay, so that's an option. But straps are great. So if you don't have a strap, I bet you have a house coat strap. Or, I don't know, there's lots of ways, a belt. So I'm going to take my strap and I'm going to lasso one of my feet into the strap here. I'm going to take the leg up in the air. So there's a lot of options when you're doing hamstrings. This leg could be straight or bent. For today, I'm going to keep this leg bent. It's really helpful if you do have a sensitive lumbar spine. And I'm going to hold the strap at the sides here. So you could hold it quite close to the foot so your arms are just hanging. Or you could hold it a little bit lower down so that your elbows are on the ground. Or sometimes people will wrap it around their hands so that their arms can hang loose and I don't have to grip too much. So there's a lot of options. Please explore that for yourself. The other thing that's important to keep in mind is that when you lock your knee, your hip crease is locked. But as soon as I slowly bend my knee, just the smallest amount, I feel that hip crease soften a little bit. So this sort of misunderstanding often is that locked knee is really important. And I would argue that to keep your knee soft is really important for keeping the hip crease soft. So a little baby bend in the knee. I'm going to maintain that. Reaching through my heel. Now, I could just gently pull the toes towards me with the strap. I can get about that far and I'm feeling it. Okay, and I could breathe here. So another option from this position would be to bend the knee a little more, just like that, and then encourage the toes to move a little bit towards your forehead. Reaching through the heels, really going to help you feel that back line stretching. Take 3 breaths here. One more. Good. Now as you come out, I always love to do a little hip mobility here. So I'm going to slide my hands really low down on the strap. I'm trying to let the strap and my arms do the work. So I'm just letting the leg move in a range of motion that feels good for me. Up and down. Really easy breezy. In different bodies, the range of motion will be different. So really getting into the fascia around the hip itself here when we move the leg in this way. As little effort as possible from the muscles. And then I'm going to find a little circle movement. So a little movement in a circle. And the other way. And then taking a moment when you're ready, we're going to place my right ankle on my left thigh. And then I'm going to take the strap and just put it aside for now. So a lot of people will notice this movement here, or this position, sometimes called the Keyhole Figure-Four. First part of it anyhow. So this first part of Figure-Four, the most important part, is we're gently encouraging an external rotation of the right hip. Some people very gently put the hand on the inner thigh to encourage that space. That might not be your preference. You might just leave your hand out. But just taking a moment to settle into this place. Something else that's really important to be aware of is the awakened foot. So there's my awakened heel. There would be an unawakened heel. This just helps the knee stay a little more stable, and it keeps us aware of our lower body. So as I go into the second part of this is where we're accessing that piriformis, the outer hip, a little bit more. So I'm slowly going to lift my left heel, and then the left leg comes off the floor. So here, one option would be this. Okay. A lot of times when people do this though, I'll see this happen, and their chest is lifted, or they're arching their backs here. So this is not comfortable for you. There's a couple options. You could use a strap. You could bring the strap in, and that way you're not reaching. That could just depend on the length of your arms. Okay, so you could use a strap behind the leg to keep it up. The other option would be the dowel. You could use the dowel. Pull it in. It's a little more awkward. The other option would be to take something, maybe your block if you have one, and place it somehow under that foot to give you a little more stability here. And that's an option too. It could be at any height that you prefer to get the stretch you desire. Okay, so take one more breath here, whichever version you'd like to do. Good. And then as I come out, the last thing in this little sequence is I'm going to add an IT band stretch. For some bodies, if the SI joints are really acting up, you might want to leave this out. It's a gentle twist that we're going to do. But like everything, it can be therapeutic, and it could be great for you today and not tomorrow. So again, use your comfort to guide your practice today. So from this position, from the first part of Figure-Four, I'm going to be twisting to the opposite side. And there are some options here. So you might even take your blanket or your block. So here's my options for foot support. I'm going to take a big breath. On the exhale, I'm going to invite my legs to fall over. So for me, my right foot is going to come right to the floor. And that's pretty comfortable for me. For a lot of bodies, they're going to be here, or, just barely almost touching the floor. In which case, you could slide something under your foot. However much, whatever you need. You could let the leg hover, that's fine too. Or if the foot's on the ground, you could hold that ankle with your opposite hand, and then you can turn the head to the other side to complete this twist. And just take 3 breaths in your gentle twist here. Taking a moment, and you're ready, head to center. Inhale, bring the legs up. The foot to the floor, making any adjustments here. And so we'll start on the other side now. We started with our hamstrings. So I'm going to lasso my foot into the strap. Take my leg up in the air, okay? And I'm going to just check in. How does the locked knee feel? And can I feel a little softening if I have that little baby bend in the knee? And then to keep reaching through the heel, to keep tugging on the back line, pressing the bent leg, that foot can press into the floor to give you a bit of leverage. And you could explore just gently pulling the foot towards you with the strap. Noticing the hamstrings here. Good. And then if you're wanting to explore how to go further in a gentle way, you might bend the knee a little more and then think of your toes moving towards your forehead a little bit. Taking 2 more breaths. That's it. Good. Now as you ease out, we'll go into the hip movement. So sliding the hands down the strap, I'm going to let the leg float up and down. Easy breezy. Yeah. Good. Yeah. And taking a moment now here with your leg moving in a circle. Think of this as sort of rolling the hip around in the socket. Yeah. And try the other direction. And then we'll go into figure-4 when you're ready. So your left ankle and your right thigh, or whichever leg you're doing now. All right. So this first part, awakening the heel, a little bit of flexion in the foot. Maybe that gentle encouragement of the thigh to kind of externally rotate here. Maybe taking a breath, encourage your jaw to soften. Good. And now we're going to be twisting after to the opposite side, so you might need to clear some space for yourself. But before we twist, we're going to work with the Piriformis. So this is a great stretch if you have tight hips or if you have sciatica that's coming from the Piriformis muscle, which is not always the reason for sciatica, but it is for a lot of people, which is a tight outer hip muscle. So from here, I'm going to lift my right foot off the floor. I'm going to let hands behind the thigh. You could use your strap. You could use the block under your foot if you want to do a little more of a sort of gentle version. Okay. So whatever is working for you today, experiment. Try different things. Taking a couple breaths. And then taking a moment in your time, when you're ready to come out, I'm going to bring my foot to the floor. Now I'm going into my twist. So I cleared a little bit of space here for myself. I'm going to move my bolster out of the way. Okay, so I'm going to go to the opposite side. I'm going to take a breath. Exhale. Gently bringing that foot to the floor. If it's not on the floor, you could slide a block under it. Or it could hover. That's also fine. For me, I can take hold of my ankle. This works for some bodies and not all bodies. Turning the head the opposite direction and taking a few breaths. So gets a little bit of IT band, a little gentle twist here. If it's not feeling good for you, come out at any time. Taking a moment in your time now, when you release your hand from your ankle, take a breath, bring the legs up. Good. And the leg comes down. Yeah. Just take a moment to readjust your body. All right. So I wanted to address a side stretch that you can do. So this class I've designed today is mainly a reclined class. The next class I teach will be sort of seated and a little bit of hands and knees. But I wanted to share with you a nice little side bend. Once again, it's something to explore slowly and gently. And if it causes you pain, then that's always a sign to back off. Not today, maybe never, or maybe just not today. So I'm going to stretch out my legs. Make sure I have enough room to stretch out. Okay. All right. So from this position, as I stretch out, I'm going to take a moment to just take a little baby step with my left foot to the left. And then my right foot will come to meet the right or to the left. So my legs are askew. If this feels really uncomfortable in your tailbone or your sacrum, feel free to back your feet up. They don't have to go over as far. And I'd really encourage you to make sure that there's no discomfort in your lumbar area and your tailbone. Okay. Now you're going to explore your arm position. So if you hold your elbows and your arms easily, comfortably go over the head and rest on the floor, great. If at this position they're here, or you feel like your back is arching quite a bit, then you just cross them over your shoulders. That's another option. So then I'm going to turn my head a little bit to the left also, and I'm going to inchworm a little bit over to the left. Not much. And I'm already feeling quite a little side stretch on that opposite side of the body. I'm going to cross my right leg on top of my left for a few breaths. Now in a yin class, sometimes I teach gentle yin. I might stay here for a minute, 2 minutes. But for today, just thought we could do like a gentle slow flow, maybe 3 to 6 breaths. Feel free to stay longer in a position if you choose to, or come out earlier. So noticing when we cross the legs, we're getting a little bit into the IT band sensation on the right leg. You could also see what it feels like to cross the left leg on top of the right. Slightly different sensation. Taking a couple more breaths here with this little side stretch. Sometimes this side stretch is called the Halfmoon Stretch, or Crescent Moon, I should say, or Banana Asana, which is super fun to say. Think banana. And then when you're ready to come out, the feet unravel, the upper body scooches back, and then the legs come back, and then the arms come to your side. Making any adjustments. So start with a little baby step to the right, and then the left leg meets your right leg. If this is feeling in any way uncomfortable in your tailbone sacrum area, just back your feet up a little bit. They don't have to go over far. 1 millimeter is sometimes enough. Then I'm going to choose my arm position, either crossing the hands over the shoulders or the hands over the head. I'm going to turn the head a little bit to the left, and then I'm going to inchworm. So this part's the awkward part. I'm just going to inchworm over a bit. I'm already feeling that nice side stretch through the left side of the body, crossing my left leg on top of my right. Take 3 breaths. And I'm going to switch now and just see how that feels to switch the other leg on top. And does that change the sensation for you? Good. And taking a moment, unraveling the feet. And the head coming back to center, and then the feet coming back to center. One thing to note there is if you feel like you don't want to let the legs move over to the side, say your SI joints are giving you some grief or just doesn't feel good for you, everybody's different, you could keep the lower body where it is and just inch over the side body and cross the legs. So a little different there would be that I just haven't moved the legs over. And so I just experiment with what feels right for me in the day, and I encourage you to do the same. All right, so I'm going to bring my knees into my chest. I'm going to do some knee circles. So this time I'm going to hold the knees, and I'm going to bring them in, out, away, and together. So another hip mobility exercise. I'm going to try that a couple more times, and then I'm going to try to reverse that motion. So if I started here and I moved out towards the body, together and away. And it could be really small. It could be this big. You might be more into larger movements and range of motion. It's taking a couple more here. Good. Yeah. Wonderful. And then taking a moment in your time for the legs to come together and the feet to come back to the mat. Okay. So I wanted to finish our class today with a gentle inversion. And for that, I'm going to have my hips supported on a support. So you have a block. You've got a 2-inch block, a blanket. Some people even use a bolster. Today, I'm going to use a 3-inch block just for fun. But you could use a 2-inch block or something lower if you choose. So got my block and I got a strap. So supported bridge, we were here before with the lower support. I'm going to press into my feet as the hips lift. I'm going to slide the block under my pelvis. Once again, I'm trying to let that lower back pelvis be really supported on the block. And just notice how that feels. Okay, good. All right, so we're going to do a little stretch now for hip crease, a little bit more hip flexor stretches. And so the first thing I'm going to do is bring in one leg and hold it. Then the other leg is going to slide along the floor. So another option here could be your dowel. It's a really nice option here. Taking a couple breaths. So adding a little extra stretching to these important muscles that get short from sitting, walking, and they're also contract under the stress response. And we've all had a lot of stress in the last few weeks. So this is a really helpful stretch. You might even in this position just take a moment to be aware of the feet, a little reaching through the heels, letting the leg go out to the side a bit and towards your shoulder, slightly increasing the stretch in the groin area a bit. Good. Yeah, and as you come back to your center, you release the foot down. Making adjustments. And we'll do the other side. So say bring the leg in, however you want to secure the hands to the leg or use the dowel. Other leg stretches out. Ooh, nice stretch there. So we're stretching all of those important hip flexors, all the muscles that connect your leg to your body. Taking some breaths here. Softening the jaw. Maybe see how it feels to let the leg go out to the side and a little bit towards your shoulder. Take a couple breaths. Good. Taking a moment to come back to center. And having your time. The leg comes back to the mat. And there we go. Okay. So for the last part, I wanted to share a little inversion with you. Inversion is just having your legs up in the air. So it's a great option if you don't have a lot of wall space. So it's like legs up the wall without a wall. So I've got the support under my hips. I'm going to bring the legs into my chest. And then as they come in, you can like adjust yourself, kind of scooch up or down so you feel like you're quite supported by whatever prop is underneath you, whether it's a blanket, pillow, towel, or a block. And then I'm going to lasso my feet into the strap. Okay. So as I bring the legs up in the air, there's a couple options again with holding. Sometimes I encourage people to try wrapping their arms around it so their arms can just hang loose, kind of a little bend in the knees. And you could just be here for a few moments, 1, 2, 3 minutes. And this is a great way to, help encourage the nervous system to calm down, great at the end of a day or into your practice. Great for restless legs, or if you want to just take a moment to flip your body upside down here. And then there's some options here. So again, you can explore. I always like to be curious and explore here. If you hold the strap on the sides like this, you could do your wide angle, reaching through the heels, pulling the strap towards you. So you've got an upside down angled fold. As you come out of that, you could bring the legs back together. This is a nice little sequence. I really love doing this little sequence here. So from here, I'm going to take a breath. On the exhale, I'm going to hinge at the hips, gently bringing the legs a little closer to me. So notice a bit of my tailbone is off the block, but I still feel supported even though I'm barely on the block. I feel quite supported here. And then I'm going to remove the strap. I'm just going to get rid of it for a second. Okay, so I might hold the ankles, I might hold the back of the legs. I might hold my big toes and reach through the heels to get a little bit more of that hamstring stretch. Could widen the legs, could bend the knees into the happy baby. And then they also have baby feet, which is bringing the soles of the feet together and holding this position for a moment or two. I really like this version, but again, depending on your hip, depending on your knee or ankle, see what works for you today. There are 80,000 variations of yoga movements and sequences. So if something isn't working for you in this video, you can just fast forward through it. Likely there's another variation that works better for you, or experiment and find something that feels right for you today. Yeah, I'm going to bring my legs together. I'm going to hold the block. I'm going to very slowly bring one foot to the floor and the other foot to the floor. And then I'm going to come very slowly off the block. So I'm going to press into the feet so that the hips can lift. So the block slides out, body comes down. We're going to take a moment for Shavasana, and I'm going to invite some of the sounds from my singing bowls here. So if you had a bolster, you could put it under your knees. You could also use a pillow. Okay. You could drop into sort of gentle version of cobbler. You could have your legs out like so. There's lots of other versions you could try. You could just have your knees bent and your feet hip width apart like we started the class. You could be rolled onto your side in a fetal position on your side body, or any other variation of a relaxing position that you could take for a few moments. And so just taking a moment to get comfortable. If you had an eye pillow, you could put your eye pillow on and you could put a blanket on. If you had a weighted blanket, you could use a weighted blanket. Oftentimes I'll use something with a little bit of weight, just placing it on the abdomen in whatever Shavasana stretch that I'm choosing. So one of my favorites is this one with an eye pillow. And then maybe even a blanket. So that could be a nice option for you. So just finding something, taking a moment. And as you settle into your comfortable position here, I'm going to sit up and do a little sound meditation for you. So once you're set up and you're comfortable, you might just take 3 big sigh breaths. Just letting any tension fall into the floor or into the props beneath you. Just encouraging your face to soften. A little bit of space for your back teeth so your jaw can relax. Your eyes can sink back into the skull so all your muscles in your eyes can soften and relax. Just taking a moment to notice the support beneath you. Notice the temperature of the room on your skin. Notice your breath coming in and out. And notice the sounds around you, the ambient sounds in the room you're in. All of these present moment awarenesses you can use to bring you back. If you notice your mind wander away into thinking, planning, worrying, judging, list making, catastrophizing. You become the gentle witness, the observer of your thoughts, coming back to the present moment again and again. Noticing the sounds. I'm going to add some sound to the space. The large bowl at the back of the room.
these last few moments in your resting pose. I'm going to share a poem with you by a wonderful poet named Dana Faulds. Faulds is her last name. She's a yoga teacher in the United States and an amazing poet. Just a poem to send you off into the rest of your day. This poem is called Walk Slowly. It only takes a reminder to breathe and a moment to be still. And just like that, something in me settles, softens, and makes space for imperfection. The harsh voice of judgment drops to a whisper, and I remember again that life isn't a relay race, that we will all cross the finish line, that waking up to life is what we were born for. As many times as I catch myself charging forward without even knowing where I'm going, that many times I can make the choice to stop, to breathe, to be, and to walk slowly into the mystery. So choosing to stay where you are, resting longer, or coming out whenever you feel like you've had enough. Thank you so much for your practice. I hope to see you again with some seated movements next practice. Namaste.